Hello everyone, and welcome to our presentation. The UCL Rare Dementia Integrated Legal Advice Clinic has prepared this presentation to provide an overview of the NHS Continuing Healthcare Program. Throughout this presentation, we will give an overview of how continuing healthcare operates, who is eligible, and we will also be condensing the information provided on the NHS Factsheet. When dealing with any healthcare-related issues or concerns, a major area of confusion is who has the responsibility to provide care. One of the aims of NHS Continuing Healthcare is to simplify this process. For any patients who have significant ongoing care needs, it is not always clear who has a responsibility to ensure that your needs are being covered. It may be the NHS, or it may be a local authority. The National Framework for NHS Continuing Healthcare and NHS-funded nursing care standardizes this process. This means that there is a uniform and clear standard that staff in England must follow when deciding on healthcare needs. An important distinction here is that NHS services are free, whereas those arranged by social services are means tested. As such, you do not have to worry about financial contributions to be eligible for NHS services. NHS Continuing Healthcare is a package of services relating to care, all of which are arranged and funded exclusively by the NHS. As part of this process, the patient must undergo a primary health need assessment, and the package that the NHS provides must meet the required needs. These needs include any health needs, social care needs, or accommodation needs, if they form part of your overall healthcare needs. NHS Continuing Healthcare can be arranged in any appropriate setting, which generally includes your home or a care home. Continuing Healthcare, or CHC, relies on two instruments, a checklist and a decision support tool. The checklist is the first step of paperwork in the NHS Continuing Healthcare process. It's a tool to help health and social care professionals rapidly assess whether an individual should proceed to have a full assessment. The decision support tool is a document which helps to record evidence of an individual's care needs to determine if they qualify for continuing healthcare funding. These will be discussed in more detail below. It is important to note that the national framework, which underpins NHS Continuing Healthcare, describes it as a person-centered approach. This means that it is a program intended to be designed around the people who may be entitled to it, and that there are some expectations about how patients should be treated. For example, staff should tell you if they think you are eligible for NHS Continuing Healthcare. They should ensure that you and your representatives understand the process and provide information and advice to maximize your ability to participate in an informed way. This may include asking about language preferences and meeting accessible information standard requirements. For example, by addressing hearing or visual difficulties you might experience and supporting you to participate. Staff should take account of how you see your needs, how they affect you, and how they might be managed. You can ask a family member or representative to support you or inquire about access to local advocacy services. You should have reasonable notice of key events, such as dates to complete the checklist or decision support tool, so your representative can arrange for you to participate. If you're eligible for NHS Continuing Healthcare, staff should take account of your wishes and the ways you would prefer to be supported when deciding where and how to meet your needs, as well as the risks of different care packages and fairness of access to local NHS resources. It is important to highlight that the system has its own specific definition for common everyday terms. Here, important examples include NHS Continuing Healthcare. This is a complete package of ongoing NHS and social care support, arranged and funded by the NHS. Continuing NHS and social care. This is an ongoing care package involving free NHS services and means-tested social care services. It may be called a joint package of care. Residential home refers to a residential care home. Nursing home refers to a care home registered to provide nursing care. And care home refers to both as appropriate. A representative is intended to include any friend, unpaid carer, or family member who is supporting you in the process as well as anyone acting in a more formal capacity, for example, a welfare officer, an attorney, or an organization representing the individual. As discussed earlier, the NHS Continuing Healthcare system seeks whether or not the applicant has a primary healthcare need. This need is determined by examining your day-to-day needs. They then consider whether a majority part or the main aspects of the care you need is focused on preventing and/or addressing health needs. As such, each patient should be considered individually, based on the facts of their own particular circumstances. This means that a patient with one particular diagnosis may be eligible, whereas another patient with the same diagnosis is not. Having a particular diagnosis, therefore, does not determine eligibility. This is because the particular needs of the patient are considered, and you may not have the same needs despite having the same diagnosis. When your application is being considered for eligibility, there is no need to establish that specialist staff are providing care. However, staff contributing to your assessment must have relevant skills, knowledge about, and an understanding of your underlying conditions. When considering eligibility, staff look at 4 key characteristics. In assessing your case, the 4 key characteristics are nature, intensity, complexity, and unpredictability. These are outlined below. Staff consider these characteristics to determine the extent and nature of the care that you require. This helps them to establish whether the care you require exceeds the limits of a local authority's responsibilities. You may be eligible for NHS Continuing Healthcare based on one characteristic alone, or by several characteristics combined. This relates to the NHS Continuing Healthcare's focus on quality and quantity tests. To demonstrate a primary health need, the quantity or quality, or a combination of quantity and quality, of care required to meet your needs must exceed the limits of your local authority's responsibilities. So nature here relates to the type and features of your needs. It examines whether your care needs are physical, psychological, or mental, and relates to the type of support or treatment needed to manage them. Intensity relates to the severity of your needs, how frequently and to what extent they vary, and the resulting level of support required. Complexity. This characteristic considers how your different needs present themselves and how they interact with each other. A more complex set of needs may increase the knowledge and skills staff need to A, monitor symptoms, or B, treat any multiple conditions. Complexity speaks to how these needs affect the management of your care. Staff also look at your response to your condition and how it affects your overall physical and mental health. Unpredictability. This characteristic considers how much, how often, and how unexpectedly changes in your condition create challenges because of the timeliness and skills required to manage needs that arise. It can affect the level of monitoring required to ensure you and others are safe, and the level of risk to you or others, unless you receive adequate timely care. So this eligibility chart is a useful chart which outlines the various routes for establishing eligibility for NHS Continuing Healthcare. But our webinar will outline the common routes for eligibility, how eligibility is determined, and how you can go about challenging a decision. So who decides NHS Continuing Healthcare eligibility? Your clinical commissioning group, made up of local GP practices, is responsible for managing the NHS Continuing Healthcare process. It makes eligibility decisions as to its registered patients, and ultimately agrees and funds any NHS Continuing Healthcare care packages. Your local group will likely have their own coordinator, who is specifically responsible for NHS Continuing Healthcare. You can look up and find your local clinical commissioning group by entering your GP's postcode on the NHS website. We have created a QR code, so all you need to do is take a photo of the square image on the screen to be taken straight to this site. There are a few different routes that your case might take when applying for NHS Continuing Healthcare. It is useful to be aware of the different routes and how each one progresses. Generally, where it is clear that there are long-term needs, the staff involved in the assessment will follow these steps. 1. They consider whether the type and level of your needs prompts them to apply the National Framework Checklist, which can lead to a positive or a negative decision. In some cases, staff may believe you should go straight to a full assessment. If the checklist aligns with your needs, this is called a positive checklist, and this will result in a full assessment of your needs. Next, a multidisciplinary team uses assessment information to complete another tool called the Decision Support Tool. This tool will affect or inform their eligibility recommendation to your clinical commissioning group. Finally, your clinical commissioning group makes the final eligibility decision. It should be noted here that the clinical commissioning group will usually follow the recommendations of the multidisciplinary team, but they can choose to not follow these recommendations in exceptional circumstances. You also have the right to challenge the clinical commissioning group, either if you receive a negative checklist decision or when you receive your final decision following a full assessment. If you have a rapidly deteriorating condition and appear to be reaching the end of your life, staff can submit the fast track tool instead. So not everyone who has ongoing healthcare needs will be eligible for NHS Continuing Healthcare. So your clinical commissioning group and local authority should agree on a system or process for identifying eligible people. If it is clear to the health and care staff that there is no need for NHS Continuing Healthcare at the moment, then they do not need to complete the checklist. If there is any doubt, they should complete a checklist. Either health staff or social care staff can complete the checklist. However, you can also approach your clinical commissioning group NHS Continuing Healthcare coordinator, explaining why you believe it is appropriate to complete the checklist. You should ask staff if they have considered NHS Continuing Healthcare, where your condition is rapidly deteriorating and you may be approaching the end of your life. You may be eligible for fast tracking. Staff are considering your needs following a stay in hospital. If your physical or mental health deteriorates significantly and your current level of care at home or in a care home seems inadequate, or if staff propose you move into a nursing home, or if you already live in a nursing home, when they conduct your annual review of NHS-funded nursing care. Before you begin the NHS Continuing Healthcare assessment process, staff must obtain your consent to be considered for NHS Continuing Healthcare, and your consent to share the necessary personal information with professionals or organizations likely to be involved. The staff should explain who the information might be shared with and how. If they are to share information for audit or monitoring purposes, staff should explain what this means. They should record your consent in your notes or by using a consent form. You have the right to refuse or withdraw your consent at any stage. If you withdraw consent, staff should try to find out why and address your concerns. They must explain that if you have ongoing needs, refusing consent may affect the ability to meet your needs. If you later agree to a local authority assessment, the local authority cannot take responsibility for covering any needs which would be considered the responsibility of the NHS. If the staff involved have any concerns about your mental capacity to give informed consent, or to refuse to an assessment or sharing of personal information, they should use the two-stage test described in the Mental Capacity Act 2005 Code of Practice. Stage 1. Is there an impairment of or disturbance in the functioning of your mind or brain? If so, Stage 2. Is the impairment or disturbance sufficient that you lack the capacity to make the particular decision required? If the answer to these questions is yes, you may lack mental capacity. If you cannot do one or more of the following: understand information given to you, retain that information long enough to be able to make the decision, weigh up the information and make a decision, communicate your decision. Talking, sign language, or muscle movements such as blinking or squeezing a hand are acceptable for communication. The staff must note their belief of your lack of capacity and must check if there is someone available to act on your behalf, such as a lasting power of attorney or a court-appointed personal welfare deputy. Staff should request to see a copy of the certificate which allows a person to consent on your behalf. A partner, family member, or third party can only consent on your behalf if appointed to do so. If there is no such authorized individual, the person leading your assessment is responsible for making a best interests decision on your behalf, as to whether to proceed with the assessment and sharing of information. In doing so, they must consult you and those with a genuine interest in your welfare, usually including family and friends. They should be mindful of the need to respect confidentiality and not share personal information about you with third parties, unless they believe it to be in your best interests for the purpose of NHS Continuing Healthcare assessments. If you can consent to the assessment, there are three important elements to the assessment that we will outline in more detail now. These are the checklist, the decision support tool, and the multidisciplinary team. So the checklist. Once it has been established that you have long-term healthcare needs, the checklist helps identify those who need a full assessment to determine eligibility. It is important that the threshold for a positive checklist is set deliberately low, so that anyone who requires a full assessment will have the opportunity. COVID-19 led to a temporary pause in completing assessments. This was lifted on September 1st, 2020, but similar measures may be introduced again. So different routes exist for applying the checklist, based on where you are currently residing. In a care home, the care home manager should contact your clinical commissioning group if they feel you are eligible for NHS Continuing Healthcare, as the clinical commissioning group may have specific procedures for care home residents. In your own home, NHS or social care staff should contact your clinical commissioning group. In hospital, Section 2.2 of the Community Care, Delayed Discharges, etc. Act 2003 states that when a patient is in a hospital setting, the hospital is responsible for ensuring all reasonable steps are taken for a full assessment of NHS continuing healthcare funding, and that this is carried out prior to discharge, where it is the case that it appears the patient has a need for such care. Can you or a family member complete the checklist? No, but you can discuss completing one with your social services staff or your local clinical commissioning group continuing healthcare coordinator. The checklist tool relies on what it calls 12 domains, or areas of need. It has 3 columns for each domain, A, B, and C, which represent a high, moderate, or no and low level of need. The assessor completes the checklist by choosing the description most closely matching your needs and should take account of well-managed needs. The checklist is designed to be straightforward and quick to complete, but does require evidence to back up the answers provided. So what is the decision support tool? Alongside the checklist, there is also the decision support tool. This also involves the same 12 categories of need, or domains, as the checklist, which are assessed based on their severity. The completed tool should give a comprehensive picture of your needs that captures their nature, complexity, intensity, and unpredictability, and the quality and quantity of care required to manage them. In the decision support tool, these are rated as no need, low, moderate, high, severe, or priority. As noted above, both the checklist and the decision support tool assess your needs based on 12 areas, called domains. These are breathing, nutrition, continence, skin integrity, mobility, communication, psychological and emotional needs, cognition, behavior, drug therapies and medication, altered states of consciousness, and any other significant care needs to be taken into consideration. In the checklist, these are rated A, B, or C, depending on their severity. In the decision support tool, these are rated as no need, low, moderate, high, severe, or priority. A multidisciplinary team holds a meeting with you or your representative to evaluate your needs based on these criteria, considering any assessment reports and evidence that you submit on the day. They use their professional judgment to complete the decision support tool, which informs their recommendation to the clinical commissioning group. The possible outcome. You will require a full assessment if the checklist shows either 2 or more domains rated as high, or 5 or more domains rated as moderate, or 1 domain rated as high and 4 domains rated as moderate, or high in one of 4 decision support tool domains with a priority level of need and any level of need in other domains. The staff should share the results of the checklist with you and your representative in writing, stating the reason for their decisions. If your checklist results in a positive decision, this means you require a full assessment, which should be completed within 28 days. If it takes over 28 days, you may be entitled to reimbursement for carrying costs for the period after the 28 days. A negative checklist result indicates that you do not need a full assessment. However, you can ask them to reconsider this or make a complaint. So who makes up the multidisciplinary team? The framework defines a multidisciplinary team as two professionals from different health professions, or one professional from a healthcare profession, and one responsible for assessing individuals for community care services. It should usually include health and social care professionals, knowledgeable about your health and social care needs, and where possible, recently involved in your assessment, treatment, or care. If the clinical commissioning group consults the local authority, it should provide advice and assistance and not allow your financial circumstances to affect its participation. If your NHS Continuing Healthcare assessment is successful, it is important to consider how your care package will be structured and delivered. This will be affected by factors such as where you intend to receive care, such as in a care home, a hospice, or your own home. So care home packages. Your clinical commissioning group is responsible for meeting the cost of your accommodation and care needs identified in your care plan. If a care home is your preferred or best option, you should be offered a reasonable choice of care homes. However, this selection may be affected by the care homes in the area, whether you should live close to relatives, whether your current care home can meet your needs, and whether your current care home is too expensive. All of these concerns will have to be discussed with your local commissioning group. Hospice packages. If you feel that a hospice package is appropriate, then staff should take account of your wishes and preferences when deciding the setting and location of your care. Hospice care may be appropriate if you're reaching the end of your life. Your own home packages. For packages involving funding your care at home, your clinical commissioning group must fund and, if asked, arrange a package to meet your identified health and personal care needs. This funding does not cover rent, mortgage, food, and normal utility bills. If running specialist equipment adds substantially to utility bills, an NHS contribution may be appropriate. If your clinical commissioning group agrees to a home-based package, and a family member or friend is an integral part of delivering your care plan, they should identify and meet training needs to help them carry out this role. So what else is provided? Budgeting. Anyone receiving NHS Continuing Healthcare has the right to have a personal health budget, unless there are clear clinical or financial reasons why they should not. Generally speaking, this budget is an amount of money you can spend to support your identified health and well-being needs and goals. It is not additional income, but instead can mean spending the money in a way that better suits you. It cannot be used simply to pay care home fees. You will also never be asked to have more choice and control over your care or your money than you feel comfortable with. So what if you are unhappy with your care package? There is a procedure for complaints, which might relate to the type, the location, or the actual content of your care package. If you are unhappy, you should notify your clinical commissioning group, who should explain your right to complain using the NHS complaints process. You may also be able to seek legal advice on whether judicial review proceedings are appropriate, in particular if you are refused a care package. So, how does NHS Continuing Healthcare affect your benefits? As a final point in this webinar, we want to briefly shine a light on how the system may affect your other benefits. If you're receiving NHS Continuing Healthcare in a nursing home, then attendance allowance, disability living allowance, and personal independent payments are suspended after 28 days from when your funding begins, or sooner if you were recently in hospital. If you live at home, you can continue to receive these disability benefits. State pension is not affected by eligibility for NHS Continuing Healthcare. Pension credit is affected as you lose the severe disability addition if your AA, DLA care component, or PIP daily living component stops. So to conclude, we hope that this webinar was helpful in breaking down some of the concepts and processes which are involved in NHS Continuing Healthcare. We have also included a short list of useful resources. These resources outline the processes and provide support to those hoping to understand more about the decision-making process. Beacon, for example, can help you navigate and understand the decision-making and the appeals process, and the impact of COVID-19 on the usual NHS CHC process. Beacon offers up to 90 minutes of free, independent advice funded by NHS England. It is helpful to be familiar with the checklist and decision support tool, especially if you or a family member is going to be present when they are being used. This link also includes a 20-minute NHS video explaining the NHS CHC process at youtube.com. We have also included a link to a public guide to NHS CHC, which is available at a gov.uk website. And finally, we've included a link to help you find free legal advice at the gov.uk website included below. We hope that this webinar has been useful and has shined a little bit of light on the NHS Continuing Healthcare process.